Okay, so I put this slide up for you because it summarizes elements of the executive summary for the California Post resource guide on pre-offer personality testing. Let me read it quickly for you. Personality tests, this is verbatim, personality tests, particularly those measuring conscientiousness, emotional stability, and agreeableness, can be useful for predicting peace officer job performance measures, including negative employment outcomes and counterproductive behaviors. A personality test can lawfully be administered prior to a conditional offer of employment if it is designed, capable of, and used exclusively for the assessment of normal range traits and characteristics, rather than the identification of emotional or mental or emotional impairment. There are clear indications that a personality test administered early on in the hiring process may aid in identifying applicants who would be disqualified in the background investigation or psychological evaluation.
And an example?
An example of a personality test?
Oh.
A CPI would be one example of that.
Can you take that as a post? A medical, including basically you've taken it early on and then afterwards, you can use the same test result, or do you have to retest them out?
No, you can use the same test results. I mean, you can consider those test results at the post-offer stage. You're not prohibited from using non-medical information at the post-offer stage. You are prohibited from using medical information at the pre-offer stage. But the more non-medical information you consider post-offer, the greater the potential for challenging the bona fide nature of the conditional offer of employment. Right?
There are some EEOC guidelines or references to that same issue about using personality testing pre-post-offer, before the offer.
There is EEOC guidance about the use of
non-medical personality tests.
And what are you referring to in particular?
Things like CPI or perhaps 16PL.
That permit it.
That allow it.
Yes, exactly right.
So it's not just California.
No, it's absolutely not just California's interpretation. No, this is California's interpretation of its permissibility under ADA and California progeny. All right, so let's take a look at some outcome data. This is data from my own. Unless indicated, you'll see that it's from this. Unless indicated, this data is from my own data set. If we take a look at post-offer only fail rates, that is, it's not bifurcated. All the psychological evaluation is done at the post-offer stage. There's no pre-offer testing. My fail rate is 25.3%. That compares to the national average of 25%. So right in there with the national average, post-offer only. If we bifurcate, we use a bifurcated model, the pre-offer bifurcated fail rate, that is those who are rated high risk, is 29.6%. So 29.6% of applicants pre-offer are rated high risk. If we remove the high risk applicants, do backgrounds only on the low to moderate risk applicants, then make conditional offers of employment, the post-offer bifurcated fail rate is 4.4%. That's very good, because you're taking out. Most of these people are eliminated here. Earlier, more cheaply, yes.
Is that 4.4% of the original sample or of the remaining 70%?
4.4% of the remaining applicants.
So it's actually like 2% or something.
Correct.
Yeah.
Correct. So 4.4% of the applicants I see post-offer are rejected. Correct. Now.
Excuse me, so that your reject rate is over 30%. 30.
The reject rate at the pre-offer stage.
Combined.
At the pre-offer stage.
No, combined. Pre and post.
Total.
Total.
Yeah, that's correct. That's correct.
And the issues if you could name the top 2 or 3 that are eliminated candidate at the pre-offer, what might those be?
In what areas are they rated high risk?
Yeah, what would,
Across the board on the dimensions. It can be conscientiousness, interpersonal, judgment.
so there's none that sort of stand out as being bigger
Con-
issues?
con- I'd say the ones that stand out biggest are the ones that Shelley named in the pre-offer resource guide, or that post named in the pre-offer resource guide. I'm not sure exactly who wrote it. And that's conscientiousness and interpersonal. I mean, judgment would be included in that as well.
Following up on that, is there any patterns or the remaining couple of percent that you eliminated post-offer?
Can you say that again?
The ones that are eliminated post-offer, is there any primary reason for it? You know, I would say that they would follow the same breadth of reasons, the same span of reasons. There may be more of a medical component, that is, there's more often people who have serious mental health issues that were not detected pre-offer and couldn't have been detected pre-offer. Might be a mood disorder, could be ADHD that is quite significant in getting in the way of their functioning. And we're going to talk in a moment about the kind of medical data that we can include that also includes some input from their treating healthcare provider.
Because your data would almost argue against doing the post-offer assessment at all.
Well, yes, if what you're saying is you're going to get your biggest return on your investment at the pre-offer stage, and you're not going to get much return in terms of identifying problematic applicants at the post-offer stage. Yeah, but you're going to need, you wouldn't have, under California's language, and probably, well, certainly 32 out of the 50 states, and if you incorporate the IACP guidelines that define a psychological evaluation as being post-offer, this wouldn't constitute a psychological evaluation. What you're really doing is you're setting up your applicant pool to do well at the post-offer stage. You're eliminating those people on the basis of the non-medical issues, which is properly done, because then, you know, the further you go in the process, the more expense the agency has attached to those candidates, the more investment they have personally in the outcome. They're far less angry when they are rejected at the post-offer, at the pre-offer stage than they are at the post-offer stage. There are a number of advantages to it. Now let's look at pass rates by race. At the low moderate risk, whites pass at a rate of 61.7%. Non-whites pass at a rate, have a low moderate risk of 69%. Males have a low moderate rate of 63.1%, and females 64.6%. This is based on a sample between 2003 and 2005 of 570 applicants. At the post-offer, whites pass at a rate of 91.3%. Minorities pass at a rate of 85.7%. Problem is that sample is less than 15. Oregon's a pretty white state. Males pass at a rate of 90.2%, females pass at a rate of 91.7%. So there's no adverse impact, either pre or post, in a bifurcated model. Post-offer only, that is a non-bifurcated model, whites pass at a rate of 75.1, minorities at a rate of 71.2, males 73.9, and females 78.9. And that's a sample size of 298. Thank you. Now, this is an outcome study done independently by Dick Wehara, who was using a bifurcated model in Colorado. And we both presented our data at a users conference at Johnson Roberts a few years ago. And at that time, my pass rate, fail rate for pre-offer that is high risk was 29.6. Independently, Dick reported 28.1. So very, very similar outcomes.
Dave,
Yes,
if I can intervene.
Please.
And at the risk of pointing out, it's not just in Oregon that you do this. I mean, Dick did it, and I think, I don't know if Christina still does it bifurcated in Colorado or not, but, you know, Herb does it in Honolulu. They have big numbers, big department,
Yep.
and they use the bifurcated system. We use it in some of our clients in Central California.
are you finding similar results?
And the results are similar. The main psychologist in the Miami Metro-Dade area uses bifurcated, exactly the same results. And so it's a very consistent pattern that it'll be 25 to 30% rejection rate using the bifurcated process pre-offer and a massively reduced rejection rate post-offer, just like you said.
Okay, so that's, you all heard that affirmation from other states and other agencies outside of Dick Wahara's sample and my own, using a bifurcated model with very, very similar outcomes.